CPD has evolved from CEUs. But for the benefits of my community, let's talk about the kind of traditional mindset around continuing education. What has it looked like in the past, and how is it evolving into a more dynamic environment that we're in right now with AI and the ability to learn from anywhere and not just having to be in a brick and mortar institution to learn?
That's a good question and pretty loaded. You can tackle it from a number of ways. I mean, for nursing, I'll just speak to that first because it really involves the entire healthcare profession. But we have mandates, and depending on your state, it's 30 hours, 30 credit hours. Some states don't have any credit hours, but you need to do hundreds if you have a specialty. But all of the research, there's a couple really big meta-analysis that have come out in the last 5 years. There was a big one from the British Medical Journal in 2021. There's another one in 2022. Lifelong Learning and Nurses Continuing Professional Development, a meta-synthesis of the literature. I just want to name these so people can go read them themselves. Nurse Education and Practice, Factors that Influence Continuing Professional Development over a Nursing Career Scoping Review. Those are just two really big ones that are chock full. Basically, they took, I'm kind of paraphrasing both studies, but they took new grad nurses, kind of mid-level nurses, and then the wily veterans, and just panel questions, observe them, took all of these research studies, and they basically said the same thing, that the way that continuing education is done, mandates are good. I mean, it's speaking to the lowest common denominator, perhaps, of people who either aren't lifelong learners, don't have the time, they're raising young families, they just got out of college, they think I know everything. It doesn't, the current state of continuing professional development or continuing nursing education is not shown to move the needle on patient outcomes.
It's
That's
huge.
kind of the summary. And all throughout both of these studies, the nurses are saying, I learned the most from at the bedside. It's called trigger learning, responsive learning. You get a patient in an ICU, it's a new diagnosis you haven't worked with before, or it's one that you haven't worked with in a long time. You go and do your patient assessment, and then what do? You go to the nurse's station when you have some downtime. You start looking up the diagnosis and how to, what's the new policy and procedure about how to take care of this diagnosis. That is shown to be the way that nurses learn and retain best. The case study reviews that go on at the nurses station, that learning environment after work, collegial, supportive, case, what went wrong, what went right, that is shown to be by the research to be the most valuable continuing education that nurses participate in, and it actually moves the needle on patient outcomes.